Chapter 12 is on the heart and cardiovascular function. So a little bit about where the heart is located. Anterior chest wall, but posterior to the sternum. It is not symmetrical. It points toward the left, and this part is called the apex, and this part up here that's attached to the body by the great vessels is called the base. Surrounding the heart is the pericardial sac, which is serous membrane. The pericardial cavity is bounded by two serous membranes. There is the visceral pericardium, which is right on the heart itself, and the parietal pericardium that forms the outer wall. And these are there is serous fluid between these two membranes to reduce friction. So here you can see the red are the cardiac muscle cells of the wall of the heart, but we were just talking about the coverings of the heart. So here we have our parietal pericardium, and then right on the heart itself is the visceral pericardium. That is the same structure as what we call the epicardium. So if you're talking about the walls of the heart, you're going to use these words epicardium, myocardium, and endocardium. These are the walls of the heart. The coverings are the parietal and visceral. But this structure here is called both the epicardium and the visceral pericardium. What is the innermost layer of the coverings of the heart? The visceral pericardium. Which of the descriptions of the heart is correct? It lies in the mediastinum under the sternum. Which of the following is not a layer of the wall of the heart? That would be parietal pericardium. An interesting thing about the musculature of the heart, it kind of travels in these figure eights, kind of swirling around. Now we need to know a little bit about the cardiac muscle tissue. You may recall it from the muscle chapter or from the tissue chapter. So these cells are smaller than skeletal muscle cells. Each cell has a nucleus, and between the cells is a connection called an intercalated disc. It is just a specialized tight connection that allows information to flow from one cell to the other. Here is the heart in the thoracic cavity. Now between the lungs is an area called the mediastinum. You can see the apex of the heart is pointing off to the left. Which of the following is not a function of the heart? Production of blood cells. So they often use this fist into a fairly deflated water balloon to represent the heart, which is the fist, and the serous membranes, which is the balloon. So here, this part is right on the fist. That's the visceral pericardium, and then there's serous fluid, and then outside that is the parietal pericardium. The pericardial contains about 15 to 50 mils of pericardial fluid, and that again is to reduce friction. You might get inflammation, pericarditis, and that would be quite painful. The serous fluid would decrease, and there might be more friction that you would feel each time your heart beat. So again, when you look at the heart, you have to kind of figure out what you're looking at. And so first, make sure you're looking at the anterior view. And yes, we are, because the apex points off to the left. You can see the aortic arch here going off the heart and going down behind the heart. There are 4 chambers in the heart, the right atrium and the left atrium, but on top of the atrium is what's called an auricle. It's kind of an expansion of the atrium to allow more blood to enter the atrium. And then down below would be the right ventricle and your left ventricle. So this is definitely the anterior view because it's pointing to the left. Now the heart is really quite covered with fat, and fat's located in this depression, this groove called a sulcus. And so we've got a coronary sulcus between this atrium and this ventricle, and we have a sulcus here between the ventricles. And so if you're talking about this sulcus between the ventricles, you could call it the interventricular sulcus. Here's a cool remnant of our fetal existence. This ligamentum arteriosum attaches the pulmonary trunk to the aorta. It used to be a connection between the aorta and the pulmonary trunk because the blood flows in the right side of the heart and goes to the lungs. This is called the pulmonary circuit. But the fetus does not require that. The lungs are not functioning, so the blood would go, any blood that went to the lungs and came, any blood that should go to the lungs in the adult would then just go right out the aorta to the body. So that's a remnant. Now you can see we are not looking at the anterior surface of the heart, we're looking at the posterior surface. Oh my gosh, look at all of these veins and arteries here. And so the blood enters the right atrium through these big guys here, these big veins, superior vena cava and inferior vena cava. I'm sure you've heard of them. So the superior vena cava drains the blood from the top of the body and inferior from the bottom of the body. And that used blood is going to go into the right atrium, then to the right ventricle, and then to the lungs. And then from the lungs, it's going to come back to the left atrium. See these 2 pulmonary veins bringing the blood from the lungs back to the heart. You can see that there is still fat on the posterior surface. Now, one thing that we see here that's really pretty important, the heart itself requires a blood supply to keep working. So the blood that is used by the heart drains into this big vein on the back of the heart called the coronary sinus. So this blood will drain into the right atrium to go to the lungs to be reoxygenated. And that's what this is talking about. The myocardium requires a constant supply of oxygen. And during exertion, our blood flow can increase by 9 times. So we are using quite a bit of blood. The blood is going to the heart by way of the coronary arteries, and we'll look at that in a second. And then the used blood is going to drain into the coronary sinus on the back of the heart. So you may have heard of a coronary. That is also called a myocardial infarction, but it is often a blood clot in one of the major arteries, the right coronary artery or the left coronary artery. So you can see here the aortic arch leaving the heart, and the very first branches off of that are the coronary arteries, the right coronary artery and the left coronary artery, to supply the heart with blood. Sometimes small connections occur between the arteries. These are called anastomoses that allow the blood to flow even if there's some blockage. So the more you exercise your heart, the healthier it becomes. It requires greater blood flow and will produce or grow these anastomoses that will connect our arteries and and allow alternative blood flow should you have blockage in one of those arteries. You don't need to know any of these. I would know the coronary sinus that drains the back of the heart, because that blood will go into the right atrium, and I would know your coronary arteries. When the blood leaves the heart, there's an incredible amount of pressure, and that stretches the aorta. The aortic walls are quite elastic. They have elastic fibers, so they stretch out and then they come back to normal. And that is called elastic rebound. And that's going to push the blood forward through the aorta into the systemic circuit. Some new terms in this chapter, and I'm pointing them out because they come up often and they shouldn't make you too nervous. A septum is a wall. So you can see here we're looking at the anterior view of the heart because it's pointing to the left. Here's a wall between the right and the left ventricle. That is a septum. And we could call it an interventricular septum because it's between the ventricles. Now you might see the word interatrial. That would be between the atria. And you also see the word atrioventricular. It is between the atrium and the ventricle. So we often talk about the AV valves. That would be the valves between the atrium and the ventricle. These valves inside the heart are called cuspid valves because they look like leaves. And this first one is a tricuspid valve. And if we follow the blood flow as it enters the heart, it always enters the right atrium. The deoxygenated blood enters the right atrium. Here's the opening from the inferior vena cava, the superior vena cava. Here is the opening from the inferior vena cava in the right atrium. And here's the tiny opening of the coronary sinus, bringing the blood from the heart itself. And that blood will first pass through the tricuspid valve and go to the right ventricle, then go to the lungs, come back, and go through the bicuspid valve. So if you're following the blood flow from the beginning to the end, the blood flows through the tricuspid before the bicuspid. Remember, tri before you bi. Now the bicuspid clinically is often called the mitral valve. You will see these little muscles here called papillary muscles, and these tiny little muscles attach to these cord-like structures, the chordae tendineae, which then form these valves. So these are going to help the valves close when the heart beats. This picture shows the systemic circuit and the pulmonary circuit. So the pulmonary circuit is taking deoxygenated blood from the heart, the right side of the heart. Here's the right atrium. The deoxygenated blood flows in to the right atrium, passes through the tricuspid valve to the right ventricle, and then out the pulmonary trunk and pulmonary arteries to the lungs. That's the pulmonary circuit. The systemic circuit is coming from the lungs into the heart and then going out the aorta to the entire body. Where are the AV valves located? Between the atria and the ventricles.